We're going to take a deep dive here into a story today making headlines. A major breast implant recall. The implants made by Allergan Inc. could be linked to a rare cancer. And San Diego plastic surgeon Dr. Richard Chaffoo is here at the table to discuss this worldwide recall. Thank you for being here.
Thank you, Kathleen.
Well, kind of get down to the nitty gritty. What is it
Right.
about these specific breast implants that differ from the others that they had to be recalled?
Of course, Kathleen. So there are two basically types of breast implant shells or coverings. There are what are called the smooth surface implant shells, which basically are fine. There was no real connection. And then there are the less commonly made ones, which are the textured surfaced implants. And as you said earlier, these were the implants that were linked to ALCL.
And you have them in front of
I do.
you, and the textured ones only make up about 5% of the entire industry.
Of all the industry, both for breast augmentation and for placement of expanders for breast reconstruction after mastectomy.
And so what are the questions that people who may be wanting to get breast implants should be asking their plastic surgeons like yourself when it comes to the actual product they're putting in their body?
So the important thing is to make sure that the product that they're using is FDA approved, number one. Number two, making sure they're seeing a board certified plastic surgeon, and then asking information about, what is the link between implants and breast cancer. And the truth is that for the textured implants, the reason why these were recalled is about 80% of these cases of ALCL, which is that form of lymphoma, were actually associated with these specific implants that are made by Allergan, these textured implants.
And they're known also as Naturel?
That's part of the name Naturel, but there's a certain style, and so you want to make sure that you get some specific details of the plastic surgeon. Do you use textured implants or do you use smooth implants? And if you do, which type or brand of implant do you use?
And how far back do these go? So if women are sitting there who've already had this surgery, what years were these on the market and how long have they been around?
So the first reported case of ALCL was back in 1997, and so the implants have been around for many years, but the FDA did come out and say, well, if you have these implants put in, if you have textured implants, for example, and you're having no symptoms, they don't recommend just routine removal of the implants, but there are symptoms that women would typically have if they develop these ALCL. They are a sudden enlargement of a breast because of a serome or fluid in the capsule, which is usually painless. There may be a lump in the breast or in the armpit. They may have systemic symptoms of lymphoma like a rash, fever, chills, weight loss, fatigue. And again, the best thing is to go in to see your plastic surgeon and have them examine you. Then if the plastic surgeon is concerned, if indeed you have a textured implant, then we can do mammography, we can look at the fluid, and the recommendations by the FDA are to go ahead and aspirate that fluid and send it off to look for specific markers to be able to diagnose it. The good news is that it's highly curable. Most of these cases are very early, and they're located within the capsule of the implant, Kathleen, and not in the breast tissue.
All right, Dr. Richard Chaffoo, thank you for explaining and taking a deeper dive into this issue that I'm sure a lot of people want to know about.
Thank you, Kathleen.
Thank you so much.